All right. I think we are live. Good morning, good afternoon, evening, wherever people are tuning in from this morning. Brad, so nice to have you here. So nice to see you. Happy Wednesday. We are live on February 26th in the middle of the week, Hump Day, as it is known here in the US. So we're excited to have everybody here. Let me start with introductions, and then Brad, I'll pass it over to you. My name is Artie Betty Pullins. I'm based in what's today gloomy, rainy Chicago, but it is going to be 50 degrees, so I will take that. I'm the president and chief healthcare officer at QuestionPro, and this topic that we're going to be talking today about healthcare strategies, recognition, recruitment, retention is a big one for me. So I'm very excited to have you here, Brad. Tell everybody who you are, introduce yourself.
Well, thank you. I'm glad to be here, and I appreciate you inviting me. I'm Brad Fetterman. I'm the Performance Point CEO. We're an organization that focuses on building strong cultures where both individuals and companies thrive, improving leadership and the pipeline to leadership, and then strengthening the employee experience and the customer experience along the way. So we have fun in this area. We deal with issues like recognition, retention, and recruitment all the time, and we have a lot of healthcare clients. So this fits.
Awesome. Well, let's get started. We're excited to have you. We'll take about 20, 30 minutes to chat, go over some data, go over your experiences when it comes to both healthcare, as well as people and what the sentiment is. So we're going to be talking a little bit about talent shortages in healthcare, the craziness happening. Not only today, but in the past from a healthcare standpoint. Why are professionals in healthcare leaving? QuestionPro, from my side, I'll share some data, some statistics, and then Brad, we'd love to hear from you, right? Like you are in this every day, all day with your customers. And then what are the 3 R's on the strategy? What can our viewers and listeners take away, and what can we do to make it better for our health systems as well? We're kind of let's start talking about the shortages. Shortages in healthcare is not something that is new, not something that has just happened because of the pandemic or prior to that. So, Brad, give us your point of view. Why do you think large scale departures are happening? Skilled professional talent. And how has that been changing from your viewpoint?
Well, I think there's a couple of things that are happening. One is you're seeing a lot of burnout, not just because of COVID, but just in general, the way the work life is in those work environments. And you're also seeing a shortage, which makes that burnout even worse, right? So, taking it out of healthcare, we have 10 million more jobs than we do people. Mm-hmm. And by 2040, we'll have about 20 million more jobs than people. We have a shortage in general across the board, not just in healthcare. Then if you start playing with immigration and turning it down, that's going to make it worse. And so we've got a lot of things that we've got to think about from a standpoint of a policy perspective. But I also think that a lot of organizations, healthcare companies, hospitals, get caught up in the macro, right? What is the policy? What's happening at the government level? How can we fix this? And I want organizations to start looking at the micro level, because if you do that, you can not only survive, you can thrive, and you can beat the pants off of your competition. And that's really what they have to do. And so I've noticed 4 core things that have been happening. First thing is people want a healthy culture. They want a culture where they can walk in and they are treated with respect and valued for who they are, not when things are easy and smooth, but when they're difficult, because that's the test, right? Your culture stands out when you're having challenges. The second thing people want is they want a sense of work-life balance. We've got people who are not willing to trade their lives for an organization anymore. And they want a company that helps them, an organization that helps them have a personal life as well as a work life. I'll take the nursing shortage as an issue. We really embraced traveling nurses, right? And with traveling nurses, we actually created a bigger problem. We gave traveling nurses more money. more flexibility, right? So they can pick and choose their shifts. And we told the people that worked for us, we're going to work you to the bone and we're going to pay you less. And in the process of doing that, we created people wanting to leave our hospitals, and it didn't work, right? So I think that's the second thing. The third thing is purpose and meaning. I want to know that I'm here to actually do something of value, of meaning, right? And in many hospitals, they get so caught up in the requirements and the legislation and the insurance that they forget about why they're there. It's one of the reasons why I've loved working over the years with Alsac St. Jude, because the first thing that comes to mind when they work with their patients is their patients and their patients' health, and all the other stuff is put to the back burner. Not that they don't deal with things, but they make it secondary as opposed to primary. And then the last one is you got to make me faster, better, and stronger today than I was yesterday. I need to be more competitive. Careers now are going to last 50 to 60 years. You have to work for 50, 60 years. Your skill set's going to go out of style every 2 to 3 years, 5 at most. That's a marathon of recreating yourself over 50 to 60 years. Employees don't want to be stale at 48 years old, looking for a job, being told your skill set doesn't work for us and I can hire somebody for half the price, right? They don't want to be in that situation. So they're expecting you to grow them on a daily basis.
Oh, 100%. I mean, I think you hit on some key points. We have some data points here collected by Question Pro's research platform, as well as our partners at McKinsey that are talking about these things, right? 31% departure, 35% within a time frame. But I think the couple of things you are really key here, Brett. Culture, right? You touched on that. You and your company really focus on that with your end customers as well. Culture is becoming, it's always been an important aspect, whether you're in a healthcare system, whether you're in a pharma company, life sciences, health insurance. So what advice can you give, or you are seeing about culture? Because demands from me as a patient, you as a patient, healthcare system is not going away. It's just getting bigger, more intense. There's the fear of AI. Oh my God, am I needed as a nurse, as a clinician, as a physician? And more importantly, I think if you work in a healthcare system, all of the clinicians and clinical teams I have talked to, there's a little bit of fear, right? Like the bots are coming, the robots are coming, they're taking away my jobs. You and I hear that all the time. So talk a little bit about the culture aspect of it, and what advice can we give, and what can you do, and how can we help from a data standpoint to listen for culture and then create tactics around it?
Well, I think a couple of things. One is culture should be built from the customer or the patient backwards, right? So you serve a community and you have a brand promise, a purpose of being there that needs to be reflected in your culture. That doesn't mean that you don't create a culture that's good for your employees. It means that your culture has to help you thrive as an organization, and you only thrive if you serve the people that you're supposed to serve, right? So you start defining your culture from the outside in. Secondarily, you do then involve your employees in that process to make sure that you're converting what you learned about what you need to do as an organization in a manner that they can digest it, understand it, and live it, right? And so I think that's the first thing. The second thing I think you have to think about is culture can't be optional for anyone. I don't care whether it's your brain surgeon, some special doctor, whomever, or the administrative person in charge of the hospital. You know, the reality is culture becomes the worst behavior you're willing to tolerate. And so if it is optional, you're allowing certain people to redefine your culture. It doesn't matter what you put on the wall. It doesn't matter what's on that placard. The only thing that matters is what they're doing. So that's the second thing I would tell you. The third thing is I think that hospitals and healthcare in general are very rule driven, and they're very hierarchical driven. The reality is we have to move in a fast, agile manner. The world's changing quickly. You talked about technology. What that means is we have to become much more collaborative, team-based, collegial, And the hierarchy in a lot of ways is actually dying, right? And so what you need to do is you need to create shared norms, that's your culture, to help guide how we're going to behave, interact, and work together. Give us the shortcuts that keep us on target. And so what that means is that administration can't be separate from your physicians. And your physicians now have to take on a leadership role, a people-centered role, not just a medical-centered role. And it means that we all have to be on a team where we're fairly equal. Yes, there are certain circumstances where certain people have to make decisions, but in general, we should be able to communicate with one another on fairly equal footing and create a psychologically safe environment for people to speak up when they see something. And I think that that's something that cultures and hospitals are going to have to shift dramatically in many cases to make work. And what that ultimately means is culture can only feed and nourish your people if you feed and nourish your culture, which means it can't be something you visit once a year. It can't be something on the wall. It's got to be something that's baked into the way that you work, operate, and meet and talk.
I love that. I love the statement you just made that culture is almost what you accept, right? Like if you're okay with, if you let burnout happen, or the risk of work-life balance happen, or the relationship between leaders within the workplace, if you let that continue to fester and foster, probably a little bit of both, right? That is one of the data points. I don't think anybody would be surprised, but when we do our research, when we do our surveys and look at patient safety surveys, culture surveys, work with our health systems to do these required data collection for CMS and ARC reimbursements, we see that often is, as you're saying, that it's not that anybody is trying to create that culture on purpose. It's almost like leave it, set it, and forget it.
Yeah.
And unfortunately, that catches up with you, right? This idea of burnout, this idea of, are you really listening to me? You did an annual survey through Question Pro. Awesome. You're listening to your employees. Great. Are you actually taking action? Are you doing something, right? Like, I know you and I talk about that a lot, being customers, your customers, utilizing some of our capabilities as well of collect, listen, but then action. So talk a little bit more about that. I know we're going to get into the 3 R's. We've been talking about the culture part, but about recognition, recruitment, and the retention piece. So this framework that we are kind of talking about, what are some of your pieces of advice that you give and help us kind of understand from that perspective?
Sure. I would tell you that recognition, a lot of companies have it, but they have programs. And programs are nice, but say you have a quarterly recognition program and someone gets recognized. It's usually 1 or 2 people. It's not everybody, right? So it's just a couple people. So you're not recognizing everybody on a regular basis, or people who are doing great work on a regular basis. You're recognizing a couple of folks. That's the first challenge with it, because a lot of these people are working their tail off and giving, even sometimes sacrificing for their work environment. And that deserves to be appreciated. So that's the first thing. The second thing is, even if you gave an award out to all the people that deserved it once every 90 days, the reality is most of those people are saying, that's nice, but how did you treat me the other 89 days, right? So recognition is about appreciation. And there's a difference, but really it needs to be about appreciation for what your people are doing on a daily basis. And what that means is, as a manager, a leader, I need to know who they are, what they value, how they want to be recognized, how often this person may need to be recognized, right? Some people don't need to be recognized at all. They once a year, once every 6 months. If you do it on a regular basis, they'll view it as patronizing. Other people, it's like, I need something weekly because I need to stay motivated. And you need to understand who that person is. Some people want to be recognized on a stage. Other people want to be privately just thanked, right? So what do they want to be recognized for? Is it the work they're doing? Is it something outside of their job responsibilities? You really need to know your people. So the first thing I would say is get to know your people, find out who they are, meet them where they are, and show them appreciation and recognition in a way that they can digest it and understand it. I think that's the first thing that needs to happen. And what that means is you have to invest in your leaders and make sure you're putting the right people in those spaces and places, and that you're giving them the training and the tools to be able to do just that. I can't tell you how many times I see on engagement surveys and on 360-degree feedback surveys, managers who are dinged for not showing recognition and appreciation, and they're shocked because they think they are, right? The problem is they're speaking Italian and the other person's speaking Mandarin, and the languages don't translate, right? They're not speaking in a language that that person can understand and really get. And I think that's what I would tell you in terms of recognition needs to happen big time.
Oh, 100%. And the stats that you're seeing here on the screen is obviously data collected from the Question Pro platform and in talking to nurses and talking to clinicians. But this idea of creating a program that fulfills everybody's recognition needs or love for like one size fits all, right? We deal with this on the healthcare side, on the other flip side of looking at data from a patient standpoint and averaging everything out, right? I know physicians are challenged with that. So we average these things out by saying, oh, if we build, to your point, Brad, a recognition program that every month we're going to recognize a clinical staff member or a non-clinical staff member or a nurse or a tech or a physician, but we don't personalize it, or we don't really recognize how people like to be appreciated, how they like to be acclimated for all the work that they are doing, and recognized in their own way. And I know that becomes hard. Like you can't cookie cutter personalize everything for everybody. But it is for sure a challenge, and especially in healthcare when you move on to hiring and recruitment from other industries. We are seeing a big influx of tech hiring and tech demand happening in the healthcare ecosystem, all because of AI, machine learning, apps, digital sensors, things like that. Health systems are looking to hire people from a different background, and their expectations are totally different. It's a totally different than a clinician or an administrative staff member in a health system. So what are some of the tactics you would share with your healthcare customers on recognition, but then also evolving recognition into the recruitment practices they have to put into place for new talent?
Sure. I think when it comes to, well, first of all, I think it's not even just recognition. I think, one of the first bullets you had up there earlier was, I think it was 1 in 5 nurses have been mistreated by their supervisor or manager. The reality is you can't do things well most of the time, and then when you're stressed, take it out on your people. If you do that, everything you've worked at gets erased overnight. I mean, just like that. And so it's really about coming in consistently and managing your own emotional intelligence, not reacting, responding in the moment in an emotional manner. People don't learn from being yelled at. They don't learn from being put down. They learn from reflection. They learn from coaching. And so if you really don't like what somebody did and you want them to change, the worst thing you can do is react, right? And so I think that is important, because I think there's two sides to that coin. There's the recognition side, but that's not worth anything if you're not behaving appropriately on a regular basis. And I've seen doctors flip out on nurses, all kinds of things. It doesn't work. It backfires. And so we've got to keep ourselves in check. But in terms of moving over towards recruitment, gosh, I think first thing, the biggest challenge you have with people getting recruited is they don't feel like it's about them. It becomes an AI-driven bureaucratic nightmare, right? Remember, we are trying to bring the right people into our organization. And we can't forget that we're recruiting people, not machines. And so you've got to build your system around the candidates and a candidate process that feels good. You know, one of the most important things is your selection process and recruiting process reflects who you are. So if I have a process that I think is not challenging, not about finding the best people, feels bureaucratic, it tells me a lot about your organization right now. And I'm going to say, I don't want to work at that hospital. I don't want to work there. So I think the first thing is you got to build it around people. The second thing is, and make it reasonable. The longer it takes, the more likely it is you're going to lose people, right? The third thing I'd say is you've got to build it around fit. We are so caught up in skill set. Well, the truth is we hire people because of skill sets. We hire a doctor because of where they went to school. And then we suffer and sometimes get rid of those doctors because they're the most difficult people to work with, right? And so the truth of the matter is fit matters as much as skill set, right? We got to look at both. So I would put in tools and steps that allow you to look at culture fit and how they're going to interact with their team members. I think that's another big thing. And then the last one, I think is really important. We did a survey and we talked to companies and we asked them how many of them believed in hiring from a broad group in the community, those that, you know, would even be individuals they might not normally see in the recruitment process, right? Minorities and other folks like that. So the answer to that was almost 100%. So, you know, companies support it, right? But then we asked a follow-up question. And the follow-up question was, what systems, tools, and processes, how many of you have systems, tools, and processes in place to ensure you're building relationships across the entire community, especially those that aren't represented in the staff of your hospital right now or in your company right now? And that dropped to between 5 and 8%.
Wow.
And so the truth of the matter is, if you want to recruit well, you've got to invest in your recruiting and in your recruiting relationships across the broad community. And companies, hospitals, et cetera, have done historically a poor job of doing that, right? They've relied on referrals, they've relied on a lot of things, but they haven't proactively invested in those relationships, and they need to start doing that.
Absolutely. I think that's a key. Sorry, not to please continue. I'm very passionate about this topic, so I can talk about this from community recruitment, community health, looking at where I know we're sort of taking an example of a health system or a hospital system that's in our backyard or that is servicing their community, but it is you're 100% right. This idea of recruiting out of your community, understanding the demographics that your health system or practice is covering, recognizing that to say, hey, what is my patient population and how am I going to take care of them? And that in itself will also help in building the culture part of things, the caretaking part of things, the lack of frustration, and all the tool sets that comes with it, right? To take care of that. And you're absolutely right. You know, I am very surprised. We work with a lot of hiring leaders, hospitals, healthcare, in the what I like to call the ecosystem of healthcare, which is everything from me going into a physician's office for a health checkup, all the way to the point that if there's an adverse event, and unfortunately I have to end up in the hospital in a system, in an acute care system, then you have the post-acute when you're out of it, you know, what therapies or therapeutics you're using. And then you're in the system from pharma, drugs, even the local healthcare grocers of CVS, Walgreens, Costco, right? To me, as a healthcare consumer, that is my entire ecosystem. And when we talk to people, look at data, do surveys, everything from a patient standpoint, customer patient, and an employee standpoint, all of those things are interconnected. And I think it's very well known in other industries. It's kind of an interesting thing that but we don't, as healthcare experts and providers and in this atmosphere, we don't look at that entire sort of journey and ecosystem and action for it based on what the data is saying. And I think that leads to one of our other things that we've been talking about is the retention piece of it, right? So recognition, obviously big, hiring the right talent based on your culture, not just skill set on a paper to say, oh yeah, you have 10 years of this experience and 5 years of that experience. But now how do you create that culture, that environment that in our data point from a study we did late in 2024, we're actually releasing a new one. Question Pro is at first week of April, but it's talking about the amount of nurses and even clinical staff that's actually looking to leave because of some of these tactics we've already talked about. Physicians, another one, so talk to us about those sort of tactic strategies that you deliver back to your healthcare customers.
Sure. So one of them is making sure that your selection process is really working. And what do I mean by that? If you're hiring people that you then have to get rid of shortly thereafter within the first year, your selection system has failed, right? So we actually work with organizations to make sure that they are hiring people who have the right fit and a good enough skill set to build on, right? And I think that's important. The second thing is if they're voluntarily leaving within the first 3 to 6 months, you have a different problem, which is you're telling them one thing in the interview, but their experience is something different. And so we work on giving potential employees, candidates, what you call realistic job preview. What are you really getting into? What does this look like? Because if I think about something and reflect on it, the good, the bad, and even the ugly, and I say, I still want to do that, then when I go there, I'm likely to stay and push through the difficult moments because I knew them up front, right? So part of the retention starts with how you bring people on, right? And select them and onboard them. I would also tell you that I think another big thing is if you know your group, you talk about your ecosystem, it means that you have worked on benefits that are not reflective of executives, but are reflective of your employees, right? And I think that's a big thing is have we created a set of benefits that make sense to our employees, that make their lives easier, that make them more livable, right? We have to think about things from that vantage point, including flexible work arrangements, right? That's a big one for folks. But what I would tell you more than anything is you really need to understand what makes people stay and what makes people leave. Yeah. Too many healthcare organizations are so fixated on pay. And there's a story I love to tell. It's J.D. Rockefeller, when he was probably the richest man in the world, was asked by a reporter, how much more do you need, right? And his response was just a little bit more, just a little bit more. And my experience is that when you get that raise and you get that bump, you're excited, right? Then you get the first paycheck, and the first thing you do is you look at it and go, great, more, but I thought it was going to be more than that. I didn't realize they were going to take so much out for taxes. And then by the time you get your second check, which is not far from that first one, you're going, when is the next raise coming through, right? And so pay is not a motivator that retains people. And it is a short-term motivator to a demotivator. It's neutral to demotivator. The only time pay really comes into play is when you're paying below market value, you're going to have a problem. But you can't fix your problems with pay. You've got to fix your problems with other issues like collaboration on a team, like leadership relationships, culture, right? All those different intangibles, those are things that get people to stay. The things that make people want to leave, if they're not done right. If they're done right, they're kind of neutral, are things like the general work environment, are things like your brand. Everybody expects to work for a brand that's good, right? It's right. I want to leave if the brand is bad, right? Yeah. And so we really, what's really interesting is if you understand why people stay and why people leave, we actually have a whole program on it called Stay. it actually helps. It helps to do two things. It helps an organization understand what they're responsible for in terms of making sure employees don't leave, because ultimately organizations, HR departments, are responsible for the things that are neutral to demotivators, the things that make people want to leave. And then it helps managers recognize what they're responsible for and what's in their fingertips, and that is what makes people want to stay. All the factors that make people want to stay are within a supervisor's or manager's reach. They don't need the corporation or the company or the administration to do things. They can do it themselves. Once you do that, they can then begin to say, okay, what's the risk of certain people on my team leaving? And what can I do to stop that from happening? And I would argue that's probably the biggest thing that a company can do, an organization can do, a hospital can do, is help their managers and supervisors understand the power they have at their fingertips and give them the framework and tools to be able to leverage that power to keep their people. Every time we work with companies and they put together risk assessments of their team, and then they have a plan on how to avert that risk, it's so empowering for managers, and it reduces turnover significantly. So to me, I think that's the biggest thing you can do, is to work with your leaders and help them understand the power they have at their fingertips and the impact that they can have on the hospital.
Absolutely. The power of data, right? I mean, that's part of what Question Pro does, not part. That is what we do, is collect data, your people data, your market data, your sentiment data. We even help you figure out, all right, how to operationalize that data now, right? Like how to actually create action plans through it, how to move your health system or your department or your division forward, how to actually look at interview data, offboarding data, culture data, benchmark it against industry data as well.
360-degree feedback data. Yeah, right? I mean, so much of it. Absolutely. Yes.
I think we have been in this environment of too much data, way too much data. What do I do with it? I'm drowning in it. How do I look at my own, collected data, new data? So we work with a lot of health systems for that, right? New data. I want to know onboarding, offboarding, culture, violence, diversity data, matching your community data. But then it comes into what I know you are not only a big proponent of, but you've written a few books around this, is how do you take that and continue to cultivate strong culture, a way to build engagement, a way to build a stronger environment. So we're going to do a little bit of a plug of your and then your future book also coming up. And for anybody listening, we will put the links on where to get these books that Brad has written. So tell us a little bit about this, Brad, and how can our listeners and viewers right now or at a later stage take advantage of it?
Absolutely. You kind of talked about it earlier. 85 cents to 95 cents of the dollar spent on engagement, on all kinds of efforts that collect data, is spent on the collection of the data, and 5 to 15 cents is spent on follow-up, right? And we really need to shift that dynamic. If you're going to invest in a survey, and I know you agree with this, then you got to invest in the follow-up, right? And so one of the things that we found was that companies want a great culture, and they kind of expect their supervisors, team leads, managers to do it, right? Build the culture. When we talk to team leads, managers, and supervisors and key leaders in the company, one of the things that we found out was, I don't have the expertise, I don't have the tools, I don't have the time to put this all together. This is really bigger than my job. And so we decided that we would start working with companies on how they could cultivate the culture in 5 to 15 minutes. All right. They're called culture workouts, huddles. We have over 500 of them, and we actually customize them for clients and give and create systems for them around building their culture. We decided we'd take 101 of those out and put them together in a book, Cultivating Culture, How 101 Ways to Foster Engagement in 15 Minutes or Less. It's basically not a book to read. It's a book for a supervisor, a leader, or a manager to use with their team every time they meet, whether they're doing daily shift meetings, whether they're doing weekly meetings or monthly meetings. They can foster an incredible team that's focused on the right things and build the culture they want using the culture workouts in that book. It is practical, it is useful, and it gives them the tools to do exactly what their organizations, their hospitals want them to do, but they don't feel like they can. So now they can, and there's no excuse, and we put it out for that reason. So that's what that book is about, and it ties into this conversation so well. Here's your follow-up right here. It's built on chapters. If you've got an issue with patients feeling like they're not being focused on, they're not happy with their service, there's a whole section in there on activities that can foster a more customer-centric point of view, a more patient-centered point of view. You can pull that chapter out and you can use the activities from that chapter. If you're feeling like people aren't focused on solving problems, but they're focused on the problem itself, we've got a whole piece on uncovering solutions. You can do all the activities from uncovering solutions to get people more solution-minded. It really does help change your environment, and we've seen dramatic results in customer service scores, loyalty scores, profit, revenue. When people put these things to work, it's an amazing thing. It's basically like micro learnings that are interactive and fun. So I push it for that reason. You asked about my second book. It's coming out in June or July. It's called Never Delegate Again, Uncovering the Secret to Growing Your Organization, Your People, and Yourself. And I am being a little facetious when I say never delegate again, but what I mean is every time we delegate, we have to stop thinking about it as transferring tasks and distributing tasks. And we have to think about it from a standpoint of how are we growing everybody? Because the truth of the matter is the world's changing so fast, and every decision we make should reflect how we're going to keep up with that pace, which means it should reflect how our company is going to grow, how our people are going to grow, and how we're going to grow. And so it's all about growth. Never Delegate Again is really about creating a growth culture that really pushes the boundaries and helps you thrive past your competitors.
That's awesome. And in the very specific healthcare context, right? It's how do you continue to empower frontline healthcare workers to take care of their patient? I mean, that's the oath you take in healthcare, right? I want to make sure my patient, in whatever capacity of healthcare you work in, is getting the help, the support, the caregiving, the nurturing needed in order to feel safe, protected, and taken care of.
Yeah.
And I think this is a perfect way to sort of wrap a bow around our conversation today is, yes, technology will keep growing. Yes, Question Pro will keep delivering data and working with our hospital systems, healthcare systems, IDNs to provide them all the statistical survey, people analytic data. You will continue to use your expertise in driving, building culture, and giving customers the how-to based on what the data is telling them to do, but arming our frontline healthcare workers, whether it be a nurse, a clinician, a physician, a caretaker, in order to how to service and how to take care of their end patient. That's the key here. Thanks, Brad, so much for joining me today. I know we ran a little bit over our 25 minutes, turned into almost 40 minutes, but this is probably a conversation you and I can have for a long time. We will put a link of your book, not only this book, but your future book in here as well as for anybody listening or watching this at a later time. We will also share the data collected from the clinician, clinical AI, as well as nursing studies that Question Pro has collected from a market research standpoint. Thank you, everybody, for joining today. Happy Wednesday, and wishing everybody a great week. Thanks, Brad.
Thank you. Take care.
Bye. Bye.